This is my star interview. Um, I don't have anybody helping me, so I'm going to just be um, reiterating the questions, I guess. So, tell me about yourself. Well, my name is Brittany Fernald. I have 3 kids, a lot of animals. I enjoy outdoors. I like to hike. I like to swim. I like to do pretty much anything having to do with outdoors. Um, I am a certified self defense instructor, and I used to be a competition level kickboxer. My past work experiences, or my work experiences, I'm an advanced EMT. I have been working for 45th Parallel EMS since 2012. I'm a level 1 instructor. Um, I am working on my level 2 instructor, EMS instructor that is. I'm working on my level 2 instructor, and I'm currently working on my Vermont State IC. I am a certified CPR instructor through American Red Cross, and I also volunteer on Pittsburgh Fire Rescue, both as a volunteer firefighter and as an advanced EMT. Um, Describe a time you worked well on a team. Well, in what we do, we have to work well on a team every day. The way that our shifts are set up, we have 2 that run, and then we have a third waiting to go if we need them. But specifically, while responding with Pittsburgh Fire Rescue, we responded to a snowmobile crash that was about 17 miles out into the woods. We're a group of 20 responders approximately. We ended up having to deploy out into the woods. We went in groups of like 3 or 4 with on snowmobiles with trailers behind us. Some of the trailers were for basically equipment, and other trailers were for patient extrication. We knew we had 2 patients going in with pretty good injury. So when we first got on scene, I was head of medical, and I had to make the decision of whether we needed to fly anybody out or whether we needed to stay and do things on scene. Basically, I made the decision to fly one of our patients out, and I sent 2 other medical personnel with him on a snowmobile, loaded him onto the trailer, got him on the snowmobile, and off they went to the landing zone. Ended up having to relay the information to scene command so that they could set up the landing zone, and off the patient went. I stayed back with the one that technically had less serious injuries, but still quite a bit of injury. We kept him comfortable and calm despite his pretty extensive injuries, and we were able to await another vehicle to get him out of the woods. We extricated him. The gentleman in question was very, very happy with our services, and he actually remembered me. Um, in the end, he actually ended up making a donation in my name to both Pittsburgh Fire and to 45th Parallel, and then found me on Facebook to thank me personally. It was a great experience. Tell me about a time when you had too many things and had to prioritize tasks. Okay, well, we were called to a nursing home, and it was for a 96-year-old gentleman who was complaining of difficulty breathing and chest pain. Upon arrival, I noticed he was sitting up, grasping at his chest, and complaining that he couldn't breathe and that his chest hurt. Excuse me. I knew immediately, from his color and the way he looked, that we had to get him out of there. We had very little manpower. It was just me, my partner, and one other gentleman to assist us, so we were able to get the oxygen on him that he required, get him onto the stretcher, get him out of the get him out to the ambulance and into the ambulance. Once in the ambulance, prioritization is very important because you have to decide what you're going to do based started by setting up nebulizer treatment to treat difficulty breathing, while my partner put on a 12 lead. Once we read the 12 lead and realized the gentleman was having a heart attack, my whole method changed. It was then time for an IV, decide whether we were going to give nitro, decide what meds I was going to administer. I ended up giving him a 500 milliliter bolus to try to bring his blood pressure up. His blood pressure was not high enough, so I couldn't give nitro. We administered care to the patient for the 10-minute ride, did what we could, kept him as comfortable as we could, and handed patient care off to the ED. When we got him to the ED, they did confirm that he was having a inferior myocardial infarction, and thanked us for our treatment and thanked us for the patent IV. Tell me about a time when you had to go above and beyond the call of duty, and how did you handle the situation? Well, I go above and beyond the call of duty every day. I consider it a part of my job. Um, we had a call for a woman who had an acute onset of nausea and vomiting. We arrived on scene, and I sort of waited a moment to see if when she moved, if it affected her nausea and vomiting, and it took me about a minute and a half to realize that it did. So now I'm thinking some kind of a vertigo or inner ear infection or something like that. Well, I know that sometimes if you keep one foot on the ground, it can actually help with the spins and help with the nausea. So I did everything in my power to help this woman keep one foot on the ground while on the stretcher and inside the ambulance. That included, well, running her IV and everything else. It was quite difficult to do because having extremities hanging off of a stretcher is not an easy thing to work around inside a small ambulance, but we did what we could. And she was very happy. When we got her to the hospital and we were handing off care, she actually pulled me aside and thanked me and said that it helped. It didn't make it better, but it actually did help. And it just knowing that we helped her feel a little bit better was a great feeling. It's about keeping the patient calm and trying to keep the patient comfortable. Tell me about a time when you worked effectively under pressure. In my chosen career field, EMS, working under pressure is something that we do every day. But specifically, I had a gentleman who, when I got on scene, was unconscious and barely breathing. It took me a few seconds to realize that it was diabetic emergency because he had a blood sugar of 27, which is quite low. Quickly started an IV and pushed D50, and he regained consciousness, and he basically came to, and he realized what he had done and thanked us. My crew stayed. D50 doesn't last that long, so we made sure that he ate a peanut butter sandwich and drank some orange juice. We saved him the trip to the hospital and the cost of an ambulance ride, and we took the opportunity to educate him, basically on checking his sugars regularly and all that kind of stuff. Community-based education is very important, so that's what we did. Give an example of a time you showed initiative. When I started at 45th Parallel, there was a serious lack of training both for employees and new hires, orientation, that kind of thing. So I quickly got my instructor certification, and as I said, I'm working on my IC, and put together a training program and an orientation program that was complete, um, with the new hires having to perform tasks, competencies, before they could basically get cleared in order to run. It also helped set up with training for continuing education and actually new education. So we are currently working towards being able to educate our own EMTs and to educate our own EMS providers so that we can create them ourselves, and not have to send them off to other locations. Is there anything else you would like us to know about you? I'm a very hard worker and very motivated. I enjoy a challenge and work well with others, or I work very well independently as well. In my chosen career field, I try very hard to understand that I'm dealing with people on what they consider the worst day of their lives. So I try to treat them with empathy, and understanding, as well as keep a level head so that I can treat them and administer the care that is needed. It's a matter of balance. Thank you very much.